5, 4, 3, 2, 1.
So let's say you get hurt, and it's not life threatening, but you need to see someone right away. Or let's say that you have an emergency that is maybe not enough to see your specialist right at the moment, but you need to get in to see somebody. Well, the urgent cares that are available are some of those resources that can help you actually get seen right away and get those treatments that you need that's not life threatening, maybe when your specialist or primary care is not available, and it can really help you out in the long run here. So here I'm actually talking with Dr. David Lemak, and he is going to be talking for the Renown urgent cares that are here in town. Going to be talking about them and how they can help you in those situations, as well as a unbelievable number of others that are out there. So I'm putting on these presentations today with Health Benefits Associates, and so I'm from Health Benefits. I help people access health care through the health insurance plans that we offer, including the Medicare plans. I have offices in Reno, Sparks, and in Carson City, and we have a team here to help you. So our main goal with these presentations is to connect you with doctors. So just like we have Dr. Lemak on the phone today, we are putting on these presentations throughout the month, and then beginning on September 15th, we'll be putting on a Mastering Medicare series where we'll be focusing on Medicare plans and the changes that are coming up here for 2022. Now, the format of this presentation is on YouTube Live. So we would really encourage you to participate by typing in your questions, type them into the chat while he's speaking, while I'm speaking, whenever. And at the end, I'm actually going to be the moderator to help ask some of those questions to Dr. Lemak. So please, I would encourage you to participate in this. This is a two-way conversation that's helped to really connect you with doctors here in town. We're also putting on another series of presentations that are going to be live through live in-person events, if we're allowed to do it, with the second round of COVID coming up and everything like that. Please check the details in the links below for further information regarding our live events that we'll be putting on. Those will specifically have to do with Medicare this year, both Medicare Advantage and Medicare Supplement. And so if you have one or the other, it's great to tune in to those or to attend those live if we're able to do it, and see how those are going, see what changes are coming up here in Northern Nevada. So without any further delay, I've got Dr. Lemak on the phone here. And Dr. Lemak, I'll let you kind of do the intro to yourself, and I'll collect some questions while you're speaking, and we'll go from there.
Terrific. Well, thanks, Alex, and thanks to Health Benefits for inviting me to talk today. I'm passionate about what I do, and hopefully I can pass along some information that's useful to the folks who are joined today or in the future. So yeah, my background is I've been a board-certified emergency physician for very nearly 35 years now. Started off my career at Rush in Chicago, went to residency in Ohio State, go Buckeyes, and then was a emergency physician and administrator at a Western suburban hospital in Chicago for about 15, 20 years, and then opened a freestanding urgent care in northern Michigan with my wife. And we did that for a little over 15 years. And then about 5 years ago, came to what I think has been our home from the beginning here in the Reno, Tahoe area. My wife and I were married here a couple of years ago, and returned to this area and joined Renown. And in the last few years, I've been the division chief of urgent care at Renown Health.
Perfect. And so it's interesting that you are So what I'm trying to find out here, a lot of people have questions about how the urgent care is really different than the primary care, um, and different on the other side than ER facilities. And so when I have people come into my office, they always want to know what that urgent care copay is, and it's usually, I mean, the gap lately between the cost for the urgent care and the cost for the ER has just grown and grown and grown. And so I really want to ask you, how are those benefits different? I mean, are they seeing that the costs are the same, or how does the cost differ when you're going into an urgent care versus an ER for you?
Well, first of all, it's important to recognize that urgent care sees a very large volume of visits throughout the country. We see in urgent care about 10% of all outpatient visits now are through urgent care centers. And part of the driving force for that is indeed the cost savings. If you go to an urgent care, the visit cost is actually no different. What the urgent care receives is no different than if you went to your primary care doc's office for an office visit. The copay may be different, but ultimately the cost to the insurer is the same as it would be for any office visit. And that's significantly less than it would be at an emergency department. You know, the ED is burdened with the need to be prepared for anything and everything. And there's a large amount of overhead associated with that.
Right. And so, I mean, are there certain situations when you talk about anything and everything? I mean, how often are you sending people? So I have a lot of clients that say, you know what, I don't use the urgent care, I just use the ER. And I really try to encourage them to, no, no, no. You know, if you have something that's not life-threatening, go into the urgent care to try to get that lower cost. But are there things that, I mean, how often is it, that you actually send somebody from that urgent care over to the ER in that situation?
Well, there's a kind of an expected national average. Urgent cares throughout the United States divert patients to emergency departments at a rate of anywhere from about 2 to 4%. At Renown, since we have a higher capability for managing more complicated issues, our percentage is a little bit less than 2%.
Wow.
So we
Okay.
do handle a lot in-house.
Yeah. Yeah. I mean, and 2%, even at 4%, I mean, that sounds reasonable. I mean, that really sounds like it's not a lot of people when you talk about people actually are maybe a little bit smarter than you think about utilizing healthcare and going into the right facilities when they know that they can get it treated by an urgent care facility.
Well, I think a good rough rule of thumb is if whatever the problem is that's going on at that particular moment is considered severe, then yes, an emergency department is probably your better choice. But if it's
Right.
something that you thought, you know, boy, if I could get this taken care of with my primary doc today, I'd do so. But it
Yeah.
really just can't wait for a couple of weeks for an appointment, or even something that's a little bit more immediate, like a laceration or a sprain or fracture or something along that line.
Yeah, right. And I mean, immediately the first thing that comes to mind when I think of the urgent care is trauma. But of course, you take care of cardiac problems. I mean, problems with dosages, prescriptions, things like that. Is that? I mean, it's a full service facility.
Excellent point. What a really well functioning urgent care system does is it responds to the need of its community. Compared to other branches of medicine that have their kind of their pipelines of what they do, urgent care can adapt more dynamically and more rapidly to what the community needs. If we've got a say a big influx of folks coming from what's that state west of us again, California? Uh, if that's the case and they're not able to be established yet with a primary care doc, but maybe they're running a little low on their antihypertensive medication or something along that line, then we fill that gap. We provide some bridge prescriptions so that people don't fall between the cracks.
Absolutely, yeah. And we talk to people every day that are moving in from not just California, majority California, but not just California. They're coming in from all over the country, and they're switching over their insurance. They know they need to do it within 30 days of moving here, and usually they're on the timeline. But of course, people get hurt while they're moving. People get hurt in those 30 days. People need to fill prescriptions in the meantime, and so they don't have a primary care doctor established. usually it's depending on their insurance if that's going to be covered and all that other stuff. But it really is their first go-to when they come to Reno to rely on here. So I'm actually going to take a question here, a couple of questions that were asked. One by Suresh, and excuse me if I'm pronouncing your name wrong here. I went to the ER last year and it was so expensive. Why is the urgent care so cheap? So what's the reason for the difference in the cost here?
Well, again, to reiterate, it's the capability of the emergency department has to be at such a high level.
Right.
It's just a big overhead. You've got all this very complicated technology associated machinery. You have staff that are capable of responding in an immediate fashion. Urgent care is a little bit more like your primary doc's office, but with the heightened capability of managing things more immediately. Another way of thinking of us is we consider ourselves the firemen of medicine. We put out the fire. Whatever the issue is, we can probably address it to some extent.
Right. Yeah, and don't get me wrong, our list of specialists here in town is extensive. And I think that a lot of people coming over from California, coming over from other states, think that we have kind of a smaller a capability to take care of them, when I think the real problem is that they're not being introduced to the right providers adequately. And so this video series actually is an attempt to try to stop that and to try to actually introduce people to providers here in town, because there are a wide range of providers, specifically within the Renown group, who can treat those kind of conditions. People just don't know about them. So it's so great to see. It is. So one other question here from Owen. Dr. Lemak, do you usually send people to the emergency room, or do you prefer treating them at urgent care? Like, are there benefits to treating them at the urgent care instead of the ER? And so is there a benefit to using the urgent care over the ER in certain situations?
Absolutely. I guess some good examples would be emergency departments have to handle fluxes of patients, and there may be a significant wait depending on how many folks have shown up at that time frame. And if your problem isn't as severe as the person next to you, you're going to be sitting and waiting for a while.
Yeah.
So there's certainly a time savings because we do handle such a broad variety of things that chances are you're going to be better spending your time making, we don't want to call it an appointment, but we have a kind of a reservation process so that you can usually get into the urgent care much more rapidly, and you're not necessarily waiting in a busy waiting room.
Right. And from a health insurance cost perspective, just from my point, usually the cost is 10 times using the ER compared to using the urgent care. And that's not just with some plans, that is across the board with the majority of plans that I'm seeing. So you spending 1/10 of the cost to go into the urgent care to see possibly the same doctor who's just rotating into the urgent care that day versus the ER, it is just unbelievable the amount of savings you can have from that.
Again, good point. What I would also point out is that urgent care, we have an overlap of nearly about 60% of the same diagnoses that are seen in the emergency department.
Right.
So think about what it is that they're seeing. Well over half of what they see, we can accomplish.
Yeah. Okay. I have a question here from Bethy. With all these, I'll leave a couple out. With all these Californians moving in here, are you going to open up more urgent care locations? So, is there plans to expand?
Renown, yes. There are certainly other urgent care facilities throughout Reno Sparks area, but certainly the intent is to expand as population grows. We currently have sites that are relatively underserved throughout the area. So for right now, we're working on redistributing the volume throughout places in the Reno Sparks area. As you know, you can get anywhere in Reno Sparks in 20 minutes.
Right. Yeah. Today you can, as long as it's not rush hour. But as they're talking about too, I mean, I know it's not maybe good for Renown to have doctors waiting in those urgent cares that aren't seeing patients, but I have to tell you, from the patient's perspective, that is good, because then you're seen, I mean, that much quicker. So that's a good thing for people that I'm talking to about going in and using those underutilized urgent cares.
Well, we also have virtual visits. During the surge of the pandemic, we in medicine we've had virtual visits, but they've been relatively underutilized. But during that time frame, virtual visits went up exponentially. And what we've learned in medicine, as well as I think a lot of people, is that there's a lot of things that can be managed through a virtual visit without necessarily having to put yourself at risk by
Right.
going into a brick and mortar place where you have to sit in a waiting area.
Yeah. Right. Yeah. And I really encourage those virtual visits. Those are something that have been included on a lot of plans for a long time. Just during COVID, they actually ended up expanding and everybody started using them. But they've actually been included on health plans for a long time. And I think really it cannot be understated using those virtual visits for something where you don't necessarily need to go in and have that hands-on, such as I think we talked a little bit before about a dermatology visit, or I personally had a terrible bee sting in California, and it ended up working out fantastic for a local issue where I couldn't get into Reno quick enough, and so that ended up being a huge help.
The virtual visits through the website. There's a listing of things that are considered to be good choices for a virtual visit. But I think a nice rough rule of thumb would be is if you don't think that somebody has to lay hands on that part of your body to make the diagnosis, it's probably appropriate for a virtual visit.
Right.
And there's a very small percentage of the time that we end up having to kind of transfer someone from a virtual visit into an in-person visit. We have a process to help make that happen, to expedite that.
Yeah, perfect. Okay, that is a good rule of thumb because there's a line, I guess. So I have a question here from Suresh. Has COVID affected the urgent care? So you kind of answered this already a little bit. Has COVID affected urgent care? Are less people going to urgent care and just going to the emergency room?
Well, actually, during the lockdown periods, both the emergency departments and urgent care saw a significant drop in volume, which was kind of scary to all of us because we recognized that meant that some people were not getting the necessary treatment that they needed. As some of the restrictions have gone away, our volume is now about where it's been in prior years, and the emergency departments are just a little bit under as well. But I think the volumes have returned to pretty close to normal.
Yeah. Okay. Good to know. Yeah. And then from Bethy here, is Renown building new urgent cares in town? And so I think we answered this a little bit before, but go ahead.
Not new brick and mortar sites as of yet. We do have some opportunities for using some of the existing structures that we have throughout the Reno Sparks area to expand urgent care in those areas.
Perfect. Thank you. Let's see. Perfect. Well, I think that actually I'm gonna probably pause it right there. I know that we've kind of been asking you question after question here, and if I didn't get to your question, I really do apologize. We will get to all the questions. I'll ask Dr. Lemak afterwards, and we'll follow up via email with you. And so, Dr. Lemak, I want to thank you for your time today. I know that it is a valuable time, and I could not appreciate it more. I think a lot of people here in town do not use the urgent care enough, and they don't understand how it works. They don't understand when their situation can be treated by an urgent care doctor. And you have had a huge impact in enlightening me and enlightening the audience here. And thank you so much for participating today.
Appreciate the opportunity, and thanks. And just as we've had this opportunity for discussion, think of the virtual visits as an opportunity just to discuss things with a physician a little bit more immediately than scheduling a visit with your primary care provider too. We're available in the same way like this to answer questions.
Perfect. Well, thank you. Well, thank you so much for attending today. We will be putting on more of these presentations coming up, and I would encourage you, if you are watching this pre-recorded, to subscribe to our channel, and that way the next time we go live, you can be notified immediately right away and participate in the discussion that we're having. Don't forget to tune in to our next Hello Health series. It'll be posted in the link below. I'm Alex Sampson with Health Benefits Associates, and thank you so much for attending today.